if doctors, hear this interview and read your book and love what you're doing and want to take it on board, is there a way that they can get in contact with you or receive further help if they have any questions?
Yes, at the moment there are a number of doctors from Australia who write to me quite regularly. They've got our protocol and everything, and they usually use me like the gang do who are doing the clinic at the moment. Just, when they get a tricky question, they write to me and say, what would you do? I usually try and answer them by replying with the set text from our library that gives instructions. Now, this is quite an important point. We've built up a library of text responses to all the clinical problems that present to us. And the doctors in our unit are not allowed to respond to any question, nor am I, without entering it from the library. Now that ensures consistency of care, and it also makes sure that the patient and their carers get all the information that's necessary, and it also avoids us making mistakes. But on top of that, that if a new problem arises, then it ensures that we discuss it amongst the group and we prepare a text in response to that. So, and then the texts get modified all the time as our data come through. And we, over Teams, we're communicating with each other. So we've got this. Some patients object to this strongly. They write to me rude notes saying you're cutting and pasting, and I write a very courteous note back saying, well, that's the only way we're going to practice because it's safe. But it creates, once again, this evolutionary epistemology. So the library, as the years pass, gets more and more valuable because there are instructions on how to handle all the different situations that occur. And I try and respond to the doctors like this using that, so that they're getting a solid thing. It seems to work quite well. I noticed that some of them are writing now much less often and with pretty hairy problems when they do. And I'm quite keen on this. I mean, I got 2 GPs in the clinic in Harley Street because I wanted to demonstrate to the world that it's well within the capacity of most doctors.